Hello, everyone. Happy Friday. I'm just going to wait for Dr. Tony to pop on here. Hello. Hi, everyone. Hope you had an awesome week. Hi, Dr. Tony.
Hello, hello. How are you?
Happy Friday.
Happy Friday.
How's your week?
Good. It's been busy.
Good? Okay,
Meeting with
good.
a lot of people this week and last week, so we're just increasing our office and keeping the community healthy and keeping their backs cracks. That's my
That's
job.
awesome. I know I wish I was local because I need it right now,
Ah,
but it
so
won't
well,
be for a
because
while.
all your stories and everything you're doing, so good for you.
Yeah. And lots of traveling. I'm so excited. We're in where we get to hike and all that stuff. So I like woke up today and I was like, oh my gosh, I feel like myself again.
Good.
Yeah.
That's
But
great.
welcome. What's that?
That's great. Yeah, it's fantastic.
Yeah. Yeah. Looks like we're still getting a few to jump on.
I like your topic though, is where you're getting things to kind of go, okay, yes, yes, how do we fix these things, but how do we look at the overall person as a whole and see what else we can do to make those things better? And
Right.
with chiropractic and what we do as a chiropractic office in Upland is really focus on people's wellness. And part of what I'm seeing as I went through some of the videos you had sent me if you want to call it relearning, not relearning, but getting the dust off my knowledge of how things work, we see a lot all day long. We see people all day that
Mhm.
are being stressed, right? They're stressed, they have problems, they can't sleep, they can't work properly, their bowels don't work properly also too. How do we incorporate that in the overall person? At that point, how do we make that person better by understanding what the symptoms are? Yes, but how do we correct it from the inside out? But also their overall life gets better and their body goes
Right.
back to homeostasis, so that when they can control it based on their own, because now they have the knowledge from you how their gallbladder works, how the liver, how their digestive system works, can maintain that. Really, once they become their own best, what I call it, their own best doctor.
Mm-hmm. Yeah. 100%. And I think that's, what I'm trying to teach on here. And, welcome everybody for being here today on a Friday. I'm so happy you're here. And I'm excited to bring on Dr. Tony today too, because he's an expert. He's a chiropractic doctor. And I wanted to bring him on because I think, as many of you guys know, I take a different approach to gallbladder disease. I take more of what we call a holistic approach. We can't just treat the gallbladder. We have to look at all the factors involved. And one of them, is kind of like the way your gut and your brain talk to each other and how that can help put your body back into homeostasis balance. And so I thought it would be awesome to have Dr. Tony on here to talk about, the role of chiropractic adjustments, specifically maybe with gallbladder function, or maybe digestive issues after gallbladder removal. Because I've experienced it myself, and I know how much chiropractic adjustments have helped me. And I think a lot of times we think chiropractors are just back adjusters or help us with neck pain, all this other stuff. But they do so much other things, specifically with digestion. So really happy to have you and happy to have everybody on here to take all the knowledge we're going to have from Dr. Tony today.
Well, it's gonna be a work in process, right? So basically, I see the question coming up: How do we, how do I get to homeostasis without a gallbladder? How do I do this? So yes, when we have things like that are sometimes surgical removal, or even because it's infected or things like that, to even the pancreas, how do we now over time supplement beyond chiropractic, beyond our overall normal health? That point, our body can actually work normally and be healthy. Obviously, in a normal American diet, it's not good for us. So and we talk about health. Health is our body going back to homeostasis, better back to balance. And a lot of it is, can we get there without a gallbladder? Yes. Can we actually get our body to feel better? Yes. But it takes someone like what we're talking about today to make our body understand, okay, what can I take? Maybe a supplement here and there, but also eat less fat. Eat things that are going to be better for our body, because now our body's more sensitive, right? That's my biggest thing. When we have something that happens to us, how do we adjust our lifestyle, not to consider it a disability, but an adjustment? So, okay, I'm maybe more aware of what I'm eating because now my body's more sensitive to not having a gallbladder. or for example, or pancreas, something like that, where now we have a problem in our body that might be internal that we have to make sure we take care of ourselves.
Yeah. Exactly. And so when you see, okay, so if someone comes in and maybe they have their gallbladder or they've had their gallbladder removed and they're dealing with digestive distress, maybe things like GERD, constant
Exactly.
bloating, heartburn, those are some, maybe even feeling nauseous all the time.
Mm-hmm.
From a chiropractic perspective, what do you look at in the individual and which areas of the body do you work on improving?
Good question. Great question. That's a long question, Olivia. I think we all answer it. Okay, I have an answer for you guys. Okay, it'll take a few minutes, so kind of bear with me. My biggest thing is we treat the body as a whole. Okay, over here, I'm gonna turn the camera on a little bit. Here is the whole body. Okay, here's the body's organs. On this side is the body's spine. It's all correlated, how they all work. Can everyone see that okay? Okay, so when we treat the spine, my job is to look at this part of the spine up here. You can see that pen okay. Up here in this part of the body to see what part of the spine and the neck itself, especially the upper part of the neck, it's called the C1, C2 area right next to the skull, that can cause what's called blocking the vagus nerve. That vagus nerve is over here. Okay, I don't know if you can see that real clearly or not. It's in part of the spine here, at the very top of the spine, and that area. And when it comes out of the skull, what happens is it can get blocked through that first canal that comes through the nerve, the one over here, causing that to become an issue. There's a small, not a small hole, maybe 2 millimeter diameter in that area where the brain stem comes away from the brain, and that vagus nerve has to travel through there. The problem with that first nerve root that comes through, the first bone, can block that area. So on this part, when it blocks it, now you have problems with that communication of that nerve that controls these organs down here. All these organs becomes an issue. So we want to make sure that nerve as a chiropractor is not being blocked. If I hear someone tell me, okay, I have problems where I have major neck pain, I have problems with digestion, I have problems with heart, even I patients come with heart palpitations. And I go, okay, what's going on here? And I'll tell them first, look, I'm looking at your structure, because that's what I do as a chiropractor, and see if this structure here can be affected in this one spot with overall here, how it overall functions the body. When I explain it to them, I go, there is a correlation, because some people come in, they have, and as you know, Olivia, they have no idea what to expect. Okay, they're coming in because now, not only am I hearing and seeing that their body, yes, they have a neck problem, but also they have problems where they have upper back pain. Okay, they have problems where their shoulder hurts. They have problems around the rib cage where it goes very front, where they have heartburn a lot or nausea. When they eat, they feel like they're going to throw up. They feel nauseous. So my thing is, okay, now I'm seeing a bigger picture of the person. How do I take steps to help them understand from a very mental perspective of actually, because they're not nutritionists, they're not someone who's in nutrition sometimes, how do I get them to understand, how do I get healthy now? What can I do now? Okay, so what I explain to them is that your body can go into what's called a rest state or a stress state. Okay, rest or stress. My job is to break it down to them. When that vagus nerve gets blocked, that first nerve from the brain down in the body, when it gets blocked, it goes from a rest state. Your body goes from a rest state to a stress state. At that point, my job is to block the nerve. The reason is that nerve can cause this. Okay, down here are a couple. It's kind of hard. It's kind of reversed. It's kind of hard to see. When everything in green here, it's hard to see that area. That green connects all the nerves together. That nerve can be affected by the autonomic nerve system up top. What that does to the body, that's your automatic system. That means when I eat something, it goes through my esophagus, to my stomach, through my digestive system, affected by the gallbladder, the liver, the pancreas, by the adrenals, and at that point goes through my body, through the small intestines, large intestines, all the way through my body. In that process, Olivia, is that an active process or a passive process?
Active.
Passive, right? Okay.
Yeah.
We call it autonomic. Okay, in neurology. That autonomic system, the automatic system of our body, should work properly under a rest state. Okay. Again, different factors of, are you eating high-fat foods? Are you eating greasy foods? Are you eating food? Take that variable aside. Our body should function in a rest state normally, where that food passes through the body, that food gets processed properly through bile production, through stomach acids for 1, 2, and digests and goes through the body naturally. The problem is
Yeah.
when it goes from an autonomic state, from a rest state to an actually stressed state, then everything gets thrown off.
Right.
Then organs become, one column, dysfunctional, not non-functional, but dysfunctional. Now things don't work properly. We put food in our stomach, and the acid might be too aggressive in a stress state to give us heartburn. At that point in the stress state, the gallbladder not function properly, so it may not produce enough bile. So now we have fatty stools. Now we have stomach pain as a result of a bad gallbladder. Our liver may not function properly, where it may want to produce, if you want to call it, not detoxify the body properly. Okay, our adrenals may be thrown off. Our adrenals controls our hormones being thrown off to where now we produce hormones that keep us in a stress state, such as catecholamines and cortisol. That's when our body learns to stay there for a long period of time. So my job, again, going back to the big picture as a chiropractor, how do I get someone from a stress state to a relaxed state so that overall their body, not only does the vagus nerve calm down, and over time get through the adjustment, get that nerve to calm down, but also make sure their overall body is healing properly too. And as Olivia knows, once someone starts, or for example, starts a treatment for a gallbladder repair, detoxification, and a liver detox, at that point it takes time for the body to change, correct?
Yeah.
Okay? It takes time. So we have to give ourselves time for our body to change, not only digestive-wise, but also neurologically too. That when we take the pressure off that vagus nerve, say maybe the neck or the upper back, then give yourself time to now, what else can I do? If I'm doing this properly, yes, I still have to eat better. Yes, I still have to watch. Now I have to learn what I can eat, what I can't eat. That'll help my body feel better. Does that kind of give you the big picture, Olivia, what I see?
Yeah, totally. And I think I experienced this firsthand with having a low functioning gallbladder or biliary dyskinesia. And I know it's becoming more and more common. And you wonder if it's, the stress or issues going on with the vagus nerve that's causing it. And through my process, I started with all my fundamentals. So I changed my diet, worked on my gut, started, exercising, doing things that felt good. But my last thing that I wasn't ever addressing was the stress.
Yep.
And so every time I would have a gallbladder attack, or maybe around my menstrual cycle when my anxiety was increasing, I started getting symptoms. And I was like, this is so strange. Why? And that's when I started looking more into the vagus nerve and incorporated things like chiropractic adjustments, or, even acupuncture, maybe some massages, different things like that I have been able to really get my symptoms under control when I focused on my stress levels and practicing the mindfulness every day, which I try to teach everybody through my page, but then as well as through the vagus nerve. And I see it tremendously improvements when clients add in chiropractic adjustments with gallbladder and improvements of digestion, like you had mentioned, the changes in the stools, like not having the fatty clay-colored stools anymore, or reduction of bloating and heartburn and the GERD. And then as well as post-op clients, it helps tremendously with people that are dealing with the throat tightening going on, like you had mentioned, the chest palpitations, GERD, gastritis, the bloating. So to your point, it's, we really have to look at gallbladder disease from a whole body perspective, and addressing the health of the vagus nerve is extremely important. And using chiropractic adjustments is one way to improve it.
And a lot of it is too, as we talked about earlier, and I didn't explain it completely yet, as you mentioned mindfulness and breathing and also stress relief exercises. The vagus nerve in your body is affected by stressors around you too. So if your body, if there's a certain level of stress your body can handle, based on your health state, at that point, once you go over that amount, at that point your body's going to react to that stress. So can we get our body over time, because that vagus nerve goes through the whole body, and so is our whole body is affected by things around us, what we see, what we feel, what we think. Okay, what we put in our bodies also, that can cause stressful events in our body, such as inflammation. At that point, can we reduce those stressors, or can we make our body more tolerant to stressors? At that point, by doing mindfulness, by doing breathing, by exercising, by lowering the stress around us, now we get our body to handle more stress, So now our stress tolerance is here instead of was before. And that
Yeah.
doesn't mean, people, you can eat French fries every day. Okay? Doesn't mean we can, okay, now that I've exercised 5 times this week, I can go have a pound of French fries. No, it doesn't mean that.
I
But
don't think anyone on here would want it.
I love French fries. That's why I say French fries. But can we do something to where, okay, if I've done this now, I still have to watch what I eat, but now I have more tolerance, so now I'm not affected by when someone yells at me, or I have a stressful event at work, or I'm tired, or I don't have things going on. So we have to realize what goes into our body through our brain, through our mouth, through our ears, through our vision, and through our thoughts is as important a stressor to keep us in a stress state or a more relaxed state. So realize, again, we have to have that balance in our lives. But when we feel that, okay, I feel like Olivia said, when I have at this time of the month, when I have a stressful event, my body reacts to that. Once you learn that, and once you learn how your body reacts to that, how do I make my body now tolerant to that? So now my body can get stronger. The problem with medications is it's treating the symptom of that stomach pain, that palpitation, that stool issue, maybe constipation, diarrhea. It's not fixing your problem in your body to make your body more tolerant to those stressors. Do you agree, Lydia?
Yeah, 100%. Yeah. Yeah. And if someone were to, so like if they're new to chiropractic adjustments, or maybe they are working with a chiropractor and they haven't asked their doctor to focus on their digestion, for someone with or without a gallbladder, what would they what would they ask you to work on, or what should they be approaching you when they come for their like first consultation?
Is what should they be saying? What should you telling me?
Yeah, so
Good.
that they're getting like so the chiropractor is focusing on some of the digestive issues related to gallbladder disease too. Or
Good.
is it just something naturally when you go see a chiropractor that they will cover some of the digestion, the vagus nerve, all that stuff? Does
And
that make sense?
embarrassing enough, every chiropractor is different. Some chiropractors
Yeah.
want to come into a room, get adjusted. They just treat the bones. Chiropractic is so general now in the sense where some chiropractors don't worry about your overall health. Let's treat just your back and neck. We're just gonna treat the pain levels you're in. Here, mid back, low back, even a shoulder issue too. We'll treat this, but not look at the whole picture. So you
Yeah.
have to be able to question the chiropractor either before you come into the office or even when you're there for your first consultation. Do you treat overall wellness? Do you want
Okay.
someone body? How do you help your body? How do you help the person overall heal, or do you just treat someone's back and neck? And they should be honest with you. Yeah, I just treat the back and neck. I want the pain level gone. Then now once you're good, get out of here. Okay.
Yeah.
Art in a sense where once your wellness for me is your quality of life. Get your body to tolerate more stress over time. That when your body is better, not just feeling better. So you have
Right.
to have questions going into any doctor's office. I'm not saying just the chiropractor, any doctor's
Yeah.
office. Is how do you get your body to heal, and can you communicate that with the doctor? Can the doctor communicate back to you of how he or she does that, and how does
Mm-hmm.
it help that person either in their office or through supplementation or a consultation with someone like Olivia, hints, at that point, get them to understand, hey, I'm going to help you with this, but even though I don't treat digestive orders, here's my reference for you. This
Right.
person knows what you're talking about. Go and talk to them also. So
Yeah.
they may not treat that, but can they give you a referral based on their knowledge of what they're doing? That point, you're getting the overall wellness, maybe not just one office or one chiropractor, but they're in their wellness referral network.
Mm-hmm. Yeah. And that's what I try to encourage like clients too, is really building like an umbrella of your
Hmm?
support team. And if you don't feel supported, that's when we should feel like you can go and ask and get different consultations from other people. And, I talk to clients about that even with dealing with gastroenterologists. Like part of going on this gallbladder journey is being an advocate for yourself. And I think this goes
Yes.
the same to your point, even with a chiropractor, is making sure that they're looking at the whole body as a perspective. Because I have come across that too.
And and also with someone who has a gallbladder or digestive disorders too, you want to make sure they treat the whole body. Okay.
Mhm.
What I mean by that is when I look at I have something that I see my patients called the spinal effects chart. Okay, it talks about on here when I it's hard to see because it's reversed, is where the spine affects the actual, what organs it affects, what locations of the body, and what symptoms you might have, including the stress response, including gallbladder, including the liver too, digestive orders too. I want someone to go, okay, if I'm gonna treat this here, but also treat this, am I just the neck adjuster? No, I'm a full body adjuster. Okay,
Okay.
so you want to take someone where they can adjust your full body to help your overall body want to heal together. And again, we talked about wellness and overall person's health, homeostasis. So you want to make sure that you see that sees the whole body as a whole, treat everything. One thing I do want to show you too, Olivia, is one of our X-rays. That's okay.
What's that?
One of our X-rays. If I show you one of my X-rays.
Yeah.
We talked about in one of my videos. Let me go over here real quick.
Okay.
Mess up out of the way. Hopefully, I don't drop anything again. It's always fun. Here, this chair out of the way. Hold on one second. Move chair. Here we go. We don't move very quickly. Apologize. Sorry for the intermission here. Okay. Here is. Let me get this out of the way too. Give me 1 second. Don't break anything. Ugh. The light off. All right. I'm all set up. Okay. Here is the neck X-ray. Okay. You got a pen that's going to work. Here, neck X-ray. Closer. There we go. Okay. There's the neck. Okay, we talked about the neck, how up here, this is back, there's a canal right here. It's the side view of the neck, side view. Facial bones here, back to skull here. Okay, all the bones of the spine, I think there's 7 of them here, all 7. At that point, this canal is where the nerve comes through. You want to make sure someone cannot, maybe not see X-rays every day, but can they treat this portion of the spine here, in that area, the top portion of the spine, and move the bones. That point, that nerve that gets blocked naturally in these areas here, that vagus nerve that gets blocked by these bones, this is called the occiput. This is C1 or the atlas, and C2 the axis. Okay, there's some mythology about it. I forget what it was a long time ago. I was about to go to sleep in class when they talked about it. But when this gets blocked, what will happen on X-ray, these areas here will squeeze together. When this area squeezes together, the problem is, at that point it can block the nerve real easily. We see that with someone, not only if someone's X-ray, we take X-rays in our office, so it's good to have an X-ray, especially have long-term problems with the vagus nerve digestive issues for one, but also once you see the X-ray, okay, how do we get the space to open up by the adjustments, but also posture? If someone's head is back here where it's more curved naturally, that posture is sitting over their shoulders, they're not leaning forward, not hunched forward, their body's more upright. So you want to make sure their body is more straight in that area, straight. At that point, it stays straight. It doesn't curve forward. Okay? So let me go back over here again. What I mean by that, Olivia, and all the 10 million people on this live right now, I'm not sure how many they are, okay, is that if I'm standing up straight, let me get this chair out of the way. I have a very small room here. I think I'm working in here. Is I want to make sure my body, if it's against the wall here, I'm touching the wall with my feet, my hips, my shoulders, and my head. That's a straight posture. As long as you're using a wall that's been approved by whatever city you're in, whatever permits they have, that should be where your body should feel normal. Okay, when you have that normality, can you step off the wall and then maintain that weight on your heels so your posture maintains that space on the X-ray, keeps that space open. That's the best thing to do for your own self to allow that overall that vagus nerve that controls the neck, but also the upper back. So if I be back up, if I'm back on a wall, and am I just helping my neck? No, I'm helping my whole body. My mid back is straight, my lower back is straight. Now the problems that come that with the vagus nerve, if you want to call it misfunction or dysfunction, also affected with the upper back, we have to treat this part too. If I'm hunching forward, that's making everything want to pinch. If I pinch the vagus nerve, you're done. We're going to send you flowers because we can't help you. Okay? We get the body to come back here over time and then retrain our because it takes time. Retrain our brain to make this your normal posture. So now we get stronger here. We breathe better here. Our body, our chest cavity stays open, so our resting breathing potential becomes higher versus lower here. That's why people have problems with heart palpitations, problems breathing overall, even throat issues too. Because if I'm here, realize if my body is hunching forward, okay, if I'm like this, what's happening to my neck? It's getting tighter. Now I've shortened the muscles in my neck to make them shorter. So yes, I'm going to have breathing problems. I'm going to feel like I'm being choked sometimes.
Right.
Yes, the vagus nerve causes some of that, but mechanically, now you shorten the muscles here and here to cause your body to shift forward. You made them shorter. Now we have to stretch them out to feel better and stay better. That kind of
Okay.
give the big picture of how posture and the spine and x-rays are related.
Yeah. And so would you say, like, for a lot of people with digestive issues, or like with issues in general, or if, we're dealing with the heart palpitations, chest palpitations, like the throat tightening after gallbladder removal, is that mostly due to the vagus nerve? So if they came in, would you be mostly working on the vagus nerve, or is there other points in the neck that
Good.
you would be touching on?
You read my mind again, Olivia. You're so good at that.
Mhm.
Is we'd want to treat the back of the neck here. I think you can see
Okay.
that back of my neck. I got a haircut yesterday for this. I got a haircut a couple days ago.
It looks nice.
Back of the neck here, behind the ears, is your occiput. Okay, we want to treat that part there to unblock those nerves. But again, there's nerves also affected by your upper back and shoulders. So we want to treat the whole body, get the whole body to shift and move those bones. So it will shift back here instead of being here. Once my head comes back more, then my neck will naturally, my shoulder will actually relax. So now I've lengthened my scalenes, my SCM muscles around my neck. So now my throat feels better. Now I can breathe better. Now I can swallow better. Huh? Amazing how the body works.
Yeah.
Okay.
No bloating.
So you make these areas move more. Again, massage, stretching, even strength training too. Strength training is huge for me to get your body strong to endure sitting for long hours at a computer.
Yeah.
Doing live Instagrams all day long like you do.
Yeah.
Okay? How do we
Yeah.
get the body to handle that? And I was talking to a mom and a daughter couple actually yesterday, and the mom kept saying, well, she's on her phone all day long. That's why she's having problems with her neck and shoulders. I'm like, no, her neck and shoulders are not strong enough to hold that position. That's the problem.
Right.
At first time, my mom's like, oh, I'm not right. But yeah, I know you're right, because your mom's always right. But can we back up to go, can make our body stronger to handle that position, so now our body learns this. So our posture doesn't correlate with blocking the vagus nerve, doesn't correlate from there, causing digestive issues and gallbladder and liver issues.
Yeah.
Boom.
Okay.
So
Boom. Yeah. So to
that's
summarize it,
my
what's
job
that?
is to see the big picture of someone. Yes, they may have neck pain, may have back pain, may have low back pain, but then treat the whole person by taking their x-rays if needed, looking at the overall posture and helping them with the adjustments, unblock the nerve, then help them correct the body back here, Olivia. So at that point, our body stays here and learns and maintains a stronger body, even with weights over time, so we can do our normal task and handle that higher load of stress versus where we are when we're in a stress state. So our body can
Yeah.
stay relaxed.
Right.
What I do.
Yeah. And that's what, to summarize it, you guys, that's the vagus nerve has a big role in your digestive health, as well as your gallbladder function, your liver function. And so part of looking at gallbladder disease from a holistic perspective is we have to look at the whole body as a whole. And one of those is through stress and the vagus nerve. And so chiropractic adjustments are one way to support that. It's just another thing we can kind of add into our bucket of tools to help us wherever we're at on our gallbladder journey. So as for, let's say, like, ways that we can support the vagus nerve at home, things would be maybe like gargling water before you're eating a meal. Maybe it's even practicing meditations or doing deep breaths before a meal. That again gets you in that rest state. So your digestion can kick into gear, your gallbladder is working well, your other areas of your gastrointestinal tract are working. But outside of those things, what are maybe some stretches or different exercises they can maybe do at home, or, how would they go about contacting you too?
Perfect. So the first thing you want to do is you had mentioned part of before we eat is we want to make sure our body's not completely a relaxed state. We don't want to be stressed when we eat, right?
Mm-hmm.
What do most Americans do? We get stressed. We go for French fries, like French fries. So at that point, we do things. We eat foods that make us feel good. So at that point, we're allowing our body now to digest food when we're under stress. Will that cause heartburn? Yes. Will it cause digestive issues? Yes. Okay. So can we get into Can we eat because we're hungry and we have to put it in our body, not because we're stressed all the time? And going back to stretching too, you talked about stretching and how do we get that vagus nerve to relax. We have to make the vagus nerve, if you want to call it, instead of being pinched where it's more locked up like a slinky, we want to stretch everything out. Okay, we stretch things out by causing that back here, just as one stretch here, back here in the spine, by doing, I call it the upper trap stretch, where we take your left hand behind your right ear, and you want to do is turn your head to the right shoulder. Then from there, let your head come down toward your body to get that upper trap muscle that attaches to that C1, C2 area to relax that area. Then from there, hold out for 30 seconds with your head turned to your right shoulder, left hand behind your left ear. Left hand behind your right ear. And at that point, hold for 30 seconds where there's enough tension where you feel a little tight, a little uncomfortable. You want to, because you're stretching more the right occiput area. You want to switch over to the other side now after 30 seconds. And now bring your right hand behind your left ear, turn your head to your left shoulder. Do the same thing. Let your weight of your arm and hand pull your head down toward your body to stretch the upper trap muscle here. Can you see that okay? You gotta get a haircut a couple of days, gotta make sure it's clear. Here, that when the upper trap muscle attaches to C1, C2, let that stretch itself out. Your overall body, I'll turn like a carousel or something, so you see that. And hold out for 30 seconds, that tension for a second, just once on both sides. Let that area stretch itself out. That's my neck stretch. But again, you can do 2-1, where if you're lying on the ground, you can use your creative abilities there, people. Lie on the ground and let your body lean back as far as you can, just even over maybe a flat bath towel folded up. Let your body come all the way back. Again, the vagus nerve is affected and effected by things in your mid-back too. So let your whole body open itself up for maybe 5 minutes here, just lying on the ground as you breathe, just normal breaths.
Okay. Yeah.
The
box breathing.
I don't know, put on some soft music or something.
Yeah, meditation and box breathing. 4 counts in.
And make sure you're listening to like music that's not like, I lost my boyfriend or my dog died, whatever it is. That's like not depressing. Like so many things are out there. But it's something where it's like, I like Sinead O'Connor, right? But she has that song like she's like lost her boyfriend and blah blah. I'm like, oh gosh. I can sing it to you, but you won't hear it. It's depressing. But again, we talked before, right? We want to breathe right. Our body's in good posture, leaning on your back on the floor, and having that mind, body, our vision, our hearing all become less stressed. At that point, everything inside becomes less stressed because it's all connected. It's all one nerve. We talk about the nerves work, right? It's all one system. In fact, but by the inside and outside, how it all works together. That's my 2 cents.
Yeah. No, it's really good. And where can they contact you?
Good. I am Dr. Tony. I work at Euclid Chiropractic, Euclid, EUCLID, Chiropractic in Upland, California, UPLAND. At that point, look us up and see we're everywhere. We're on Instabook, Facegram, TikTok, YouTube, all the hacks and tubes.
Yeah, Dr. Tony does a lot of good videos and exercise, right? Flexibility stuff for at home too. But
the law of it is we have to keep ourselves physically moving and strong so our body stays in a relaxed state. Again, I said it for a couple times already, so we can tolerate our stressors. With COVID we had the last couple of years, all of us have moved less. All of us have been told to move less. All that have done takeout and drop off to our house, Instacart and all the other stuff that people do has become a household name. Now, how do we go, okay, but now how to go back to what's good for me versus what's easy for me?
Yeah.
And it's not the same thing. If it's comfortable, you're not doing enough. If you can walk 10 minutes and it feels easy, walk 15.
Yeah.
If you eat foods that feels like, it's easy for me, then what else do you that's healthier? You know, do a little bit more for yourself. It's about you. It's not about me. My back feels fine. My vagus nerve feels great today. I'm doing good. Okay? But can you take care of your body by listening to Olivia, which does in these shows, and learn on your own what you can do? It's all free, right? Internet's still free. We pay our Wi-Fi bill, but that's about it. Use it, people.
Yeah, exactly. Yeah, so thank you everybody for joining. I hope you guys took something from this. As you know, again, just a reminder, look at gallbladder as more of a mind body journey. And outside of looking at your fundamentals, your diet, your exercise, movement, stress, chiropractic is another modality that you can add in to, help improve overall just health and wellness. So I hope you guys learned a little bit more from this, and hopefully you can kind of take this back and find a chiropractor in your area or talk further with your existing doctor.
Yep. And thank you for all the comments. I've seen in the comments also, so I can sometimes multitask. Yeah, it is my name at my Instagram is at drtonychiro.com. At that point, look me up, and like I said, my information is free. Look at my Instagram; it's all free. I do a podcast. I did it with Olivia a couple of times too. I want people to get healthy. As a chiropractor, our ethical job is to be health educators. That's our number one job. And we're a doctor in the U.S. is an MD, a DO, and a chiropractor. So our job is to make sure we keep our communities healthy. That's my job, and hopefully we can educate and also entertain at the same time, right? That's the plan, Olivia.
Yes.
I don't juggle, but I'll be able to learn how to juggle, make people more entertained. I don't know what you can do. But thank you guys for all the good comments. I appreciate all your love, and thank you for having me on the show.
Yeah. Thank you, everyone. You have a wonderful Friday and weekend. Thanks, Dr. Tony.
Thanks, guys. Have a good day.
Bye.
Bye.